But until that gets underway, we will turn our attentions to British politics because the Prime Minister Theresa May has called the Red Cross irresponsible and overblown for talking about a humanitarian crisis in the NHS and social care. At Prime Minister's questions, the Labour leader, Jeremy Corbyn, said the NHS was in crisis, but that the Prime Minister was in denial. Our political correspondent, Ian Watson, reports.
Some medical professionals are issuing critical warnings of the worst ever winter crisis in the NHS in England. Now Labour want to turn this into a political crisis for Theresa May. So Jeremy Corbyn told the Prime Minister she needed to pay attention to the concerns of the professionals and the patients.
Can I ask her if she'll listen to Sian, who works for the NHS? She has a 22-month-old nephew. He went into hospital. There was no bed. He was treated on 2 plastic chairs pushed together with a blanket. And she says one of the nurses told her sister, "It's always like this nowadays."
There was a sharp intake of breath from the opposition benches when the Prime Minister urged MPs to put the problems in proportion.
I accept there have been a small number of incidents where unacceptable practices have taken place. But what matters, we don't want those things to happen. What matters is how you then deal with them.
Earlier this week, the Prime Minister said she wanted to create a shared society. Well, we've certainly got that. More people sharing hospital corridors on trolleys. More people sharing waiting areas at A&E departments. More people sharing in anxiety created by this government. Our NHS, Mr. Speaker, is in crisis, but the Prime Minister is in denial.
The last thing the NHS needs is a cheque from Labour that bounces. The only way that we can ensure we've got funding for the National Health Service is a strong economy. Yesterday, the Right Honourable Gentleman proved that he's not only incompetent, but that he would destroy our economy, and that would devastate our National Health Service.
This major hospital is really just a heartbeat away from the politicians at Westminster, so the NHS is never really far from their thoughts. The government say they have met the pressures on the NHS by increasing funding and bringing about improvements. The opposition parties don't think that's good enough. But what would they do if they had the power?
Well, the Lib Dems have set up an expert panel to look particularly at the idea of a dedicated health and care tax. And set alongside that an independent assessment of how much money the health and care system needs.
But I asked why he didn't do this when he was in government.
Well, we were talking about it, and indeed I went onto the BBC television news to make the case for more money for the NHS.
But it didn't happen.
Well, that was towards the end of 2015, and we did get an extra £2 billion for the NHS prior to that.
Labour say that with a cold snap forecast, demands in the NHS are likely to increase, and the health service itself is now in need of urgent care.
In the immediate term, we would argue bringing forward 700 million for social care, which is allocated for 2019. Let's not wait till 2019.
It's £700 million. That's just a down payment. That's not enough.
You're quite correct. We need to look at this and across the board for the long term.
Labour now feel the government's vulnerable on the NHS, but the Conservatives will continue to argue that only they can provide the robust economy that will pay for it. Ian Watson, BBC News, Westminster.